Hello everyone, welcome to our Mother's Health podcast. My name is Dr. Viviane and I'm your host. And I'm going to be discussing a very important topic, quite damning, but very important topic. And my topic asks some very critical but sensitive question. And here goes my question. How many times should a mother have to ask for help before she's listened to? And this is a case of the Nottingham Hospital scandal involving 2,500 families and led to harm and death of up to 500 mothers and babies in the Nottingham Hospital. Now, this is a case of lack of accountability, a case where women were being ignored when they ask sensitive questions, and a case of lack of patient safety. In the last episode, I talked about disrespectful care in the Nigerian healthcare setting, and you can go watch that video. I'm going to put a link to the video in the description box, so go ahead and watch that video. And I think one thing I talked about strongly in that video is the need to create a healthy culture where women can thrive, have better birth experience, and to provide healthcare workers with the tools, the facility, the resources to equip our staff to give women better healthcare experiences. But looking at the Nottingham case in a civilized country like the UK, I'm shocked, to say the least, that this kind of scandal can still happen in the UK. I thought if we had the best resources, if we have the best equipment, that could help ease things off a little bit. But yet we have our own issues that we are faced with in the UK, and it's a cultural issue where women are being ignored, and where the leadership has not paid particular attention to women patient safety in the UK. I'm also going to put a link to the publication on the Nottingham Hospital case. Now, in this first segment, I'll first of all address this very critical question. How should healthcare providers or carers or nurses or midwives, how should they respond when women say something is not right? I don't feel right. Because going by this report and what has happened in the Nottingham Hospital, it clearly indicates that when women report any consent, that they are being ignored. And this shouldn't be the case in a civilized country like the UK. No woman should be ignored because of her race, because of her location, because of her status. I think the response should be, regardless if you think that these questions or these issues raised by women are insignificant, that it should be, and it should be taken seriously. It should be reported. It should follow due process and procedures. But again, just like in the Nigerian healthcare system, we have peculiar problems. We are also faced with an overburdened system. We are also faced with staff shortages. I'm not making excuses and why this has happened, but these are some of the reasons why things like this could happen in the UK, even as civilized as the UK system appears to be. One of the most repeated problem and issue with the Nottingham scandal is that, I don't know if it's still happening, there was cases of issues that were raised by women being ignored, and there was poor escalation of cases, poor referral on time. There was missed opportunity to act promptly to issues concerning women, and this led to some of the deaths and some of the harm that we see in that case. As an advocate for maternal health care, I feel deeply troubled that issues were not escalated quickly in these hospital settings. And I would like to emphasize that women know their body. They know when something is not right. They know when they describe their symptoms to you, they are not pretending, or it shouldn't be taken lightly. It should be taken seriously. It should be escalated. It should be dealt with promptly, because there were a lot of missed opportunities to escalate the issues and to deal with things promptly. So that led to delayed interventions in this case, and of course contributed to loss and death of these mothers and babies, up to 500. This is alarming. This has never been heard of, and this is of an accumulative case of lack of action by leaders in the setting, because it didn't just happen overnight. Incapability, the leaders, and by the leadership, by the management, by key healthcare professionals, and inability to identify and deal with issues promptly over a period of time. And I wonder why, reading this case, if nobody picked up on these patient safety issues, if this was not discussed in meeting, why was there so much lack of accountability within the system? It's quite alarming, this report, and it calls for a lot of rethinking about our culture and the way we respond to issues and the way we respond to complaints by women. I think this is going to lead to a lot of national change and agenda in the maternal health care settings. And I'd like to add that listening to women is one of the most effective clinical tools that we have in healthcare. So listening is critical to intervention, to solutions, and to reducing death rates in any setting. In this segment, we're going to be discussing when systems stop listening. Part of the mistakes made by the Nottingham hospitals. Now, the report identified deeper issues within, systematic issues within the Nottingham NHS. And part of what was identified was toxic workplace culture, failures in the leadership, bullying, fear, and a toxic work environment, shortage of staff to respond to people's issues, to respond to clinical demands. And this is also what was highlighted in the Nigerian healthcare setting. So it's fair to say that in all healthcare settings around the world, or healthcare systems around the world, we all have our peculiar issues that need to be tackled, and it could vary from one council to another. But the truth being told, there are deeply rooted things in cultures and systems that must have led to these sort of failures, and that is a lack of accountability, toxic culture, bullying, fear. And under this condition, it's very difficult for positive outcome, and also to create a culture where women can be attended to without harm, basically. So I'm going to be looking into this even further, because ultimately, when the system is toxic, the patients suffer, mothers suffer, babies suffer. Ultimately, death is inevitable in these cases. This is why improving healthcare is not just about the equipment, it's not just about buying sophisticated structures or building sophisticated structures. It's also about the culture. The culture is as important as buying those equipment and gadgets. Now I'm going to talk about medical gaslighting in maternal health. A lot of times women come with these complaints: oh, I don't feel right, I can't feel my baby, I feel pain in my abdomen, and they're being gaslighted to say this is fine, I don't think there's any complication here. And as a result, based off on this Nottingham case, critical moments were missed that led to death. Now, women should not have to feel like they are being difficult when they ask questions. I understand, again, like I said the last time, there's pressure on the system, but in as much as we have this pressure on the system, the safety of women should be paramount. So when they come with issues, it can be documented, it can be followed, it can be looked at critically. It shouldn't be dismissed. And women should not have to feel invisible when they're having their children or they're going through the childbirth experiences. Now, many families affected. What are the families asking for? Particularly, not just in the Nottingham Hospital, but many other areas in the NHS, or many other hospitals in the NHS. What are we asking for as families, as advocates for maternal health? What are we asking for? We're asking for clarity. We're asking for accountability, and we're asking for answers. This is not the time to blame. This is not the blame time. It's not the blame culture. But we want to see practical changes in our hospital settings. So we're asking for answers, accountability, so that future generations of future mothers will not have to suffer some of the consequences of what happened in the Nottingham Hospital. So it's fair to say, it's fair to ask, and I'm also glad that we live in a very civilized society in the UK where we can hold people accountable, we can hold leadership accountable for their actions, and we can make this, publish the inquiries and work on solutions to make our system better. But when it comes to some of these developing countries, you can't hold them accountable because of fear of retribution, fear of being punished, and fear of losing their jobs and source of livelihood. And like that, the leadership is being held accountable. So what then can we do to change? In order to change, what we can do is to better equip our hospitals with skilled workers, better staffing, one, stronger leadership, accountability, clean lines of communication is very critical. A system that listens, a system of compassion, a system that will listen when women complain, a good reporting line, a good communication system so that issues can be quickly escalated. That's what we need in the NHS today. And I believe that changes are going to be made. I'm glad there's a new integrated care system. It's quite been going on for a while. And the integrated care system, the UK, will help to bring about collaboration with workforce so that many practices can work together to bring about safer maternal health care. So I'm very glad. I'm looking forward to seeing the outcome of the integrated care system in the UK and how this can impact significantly on maternal health. So if you have any paper publication, any discussion on how integrated care system can help to improve maternal health, I would love to see those publications. I'd like to be engaged with those contributions. If you're a healthcare professional as well, you'd like to have this conversation with me, I'll be happy also to host you and we can discuss this even more in depth. And in conclusion, the Nottingham Hospital case, reflecting on the Nottingham Hospital case, in conclusion, it reminds me that every case, every statistic represents a family, represent a child, a life changed forever that cannot be replaced. The question is not about whether the Nottingham Hospital or healthcare system can afford to listen to patients or women, but the question is, can they afford not to listen? Because not listening is very costly. If there's anything in this case, it teaches us that listening is not an option, it's not an extra, it's not optional. It shows that listening is not optional in healthcare. It's paramount to our healthcare, it's critical to our healthcare. Listening can save life and listening can provide better outcome for our women and for maternal care. So thank you for listening, everyone. Once again, this is Our Mother's Health podcast and I'm Dr. Viviane. And make sure to support this podcast by liking, sharing, and also leaving your comment to let me know your opinion on the Nottingham scandal. If you followed it, I'm going to be leaving all the links for you to review the Nottingham scandal in maternal care review. Thank you for listening today and have a lovely day.